Hello, everyone. Dr. Hanisha here. Thank you so much for joining me on my podcast, Mahan Health with Dr. Hanisha. Mahan literally translates to great in Sanskrit, and it just doesn't make sense to have anything but the absolute best when it comes to your health. My goal is by you listening or watching this podcast, you're getting just a little bit closer to achieving Mahan or great health yourself. This podcast is all for you, so please make sure to comment what you'd like to learn more about so I can get a guest on the show who's an expert in that field, or I might even talk about it myself. I am now seeing patients and clients all over the world virtually, so please make sure to book your free 15-minute phone call today to see how you can start achieving Mahan or great health yourself. Today's episode, I had the opportunity to interview a friend and colleague, Dr. Sarah Duhon. Dr. Sarah Duhon has a doctorate in naturopathic medicine and a bachelor's in the science of nursing. She completed over 200 hours of functional neurology education under the instruction of Dr. Melillo and Dr. Datis Kharrazian, and has also completed a series on multi-system autoimmune diseases instructed by Dr. Shikhman. Dr. Sarah's passion is to bring an abundance of education to help empower the community to take control of their health so they can learn to doctor themselves. Her passions in natural medicine encompass autoimmune disease, pediatric neurological developmental disorders, and environmental toxicity conditions, as well as naturopathic approaches to treat infertility and promote a healthy pregnancy, birth, and postpartum period. She was a certified lactation counselor in her early years of nursing and continues the education in her medical practice. Dr. Sarah is also married and the mother of two beautiful, healthy boys. She used her personal experience as well as clinical experience to write the book Preparing for Pregnancy, the ultimate step-by-step guide to enhancing fertility and nurturing a healthy baby without sacrificing your health. She is currently consulting at her naturopathic wellness clinic, Illuminate Natural Health in Baton Rouge, Louisiana. Dr. Duhon is a wealth of knowledge, and I'm so excited for you all to hear our conversation. So make sure you leave comments below on what you thought of the episode and reach out to Dr. Duhon or myself after the show. All right, enjoy. Dr. Duhon, how are you doing today?
I'm doing great. How are you doing?
Good. Enjoying that quarantine life right now.
Yeah, some R&R.
Yes, exactly. So, well, thank you so much for joining me on my show today. I really appreciate having you.
Yeah, thank you so much. I'm excited to get to talk about this information with
Yes,
a whole
definitely.
large audience.
Yes, definitely. Okay, so I always start with this. Tell our listeners a little bit more about your journey and how you got to naturopathic medicine, because I feel like we all have such unique stories, and I love hearing everyone's stories, and I hope our listeners do too. From my experience, they do too. So, so tell me a little bit about your story and your journey and how you got to where you are today.
Yeah, so I didn't always start off natural minded at all. I actually, I was a registered nurse for a few years before discovering naturopathic medicine. And I was in this complete conventional mindset. Like I wasn't a person that used a ton of prescription medicine because my mom just never taught us that way. But every other people who were sick, I was around a lot of people with diabetes and hypertension. I just thought you get on a medication, you do that. I was taught in nursing school a certain way, and I was in that mindset. But then I met my husband, who was very natural minded. He had childhood cancer, and he changed his entire life and approach to medicine after recovering from that. But he challenged basically everything that I was taught from nursing school and life, and it changed my perspective on it. So when I found out that there was a such thing as naturopathic doctors, which I had no clue until right before I applied, I started my journey right away because there was a moment I moved to Colorado. I was a nurse in the postpartum unit. So I worked in quite a few places. I moved quite a few places. So I've been in the whole realm of medicine within the hospital field. But I was on the postpartum unit with mother and baby, and I became a lactation nurse and loved it. And so that was my first kind of step into a natural field of natural birth and be able to provide the nutrition to the baby without having to supplement it. And I worked at a baby-friendly hospital, so it was a hospital that just promoted all of those things for natural bonding between a baby and mom. So I kind of fell in love with this idea. But then I was also designated to things such as, giving vaccine to newborn babies. And now I'm not totally anti-vax. I'm not going to go anywhere like that with this, but I definitely felt like an ethical dilemma with giving a newborn baby any medication. And there was one incident where I had a sweet little baby, like a little 7-pound little sweet thing that I vaccinated them with the Hep B vaccine. And we don't know if it was connected or not, but later on that evening began to have seizures. And this was something to me that just, it really kind of took me back. I didn't feel comfortable with that, having to make that decision as a nurse. So I immediately was just like, I can't handle this anymore. And I switched to adult care after that. And when I did that, it opened my mind even more. So when I went to, it's called medical surgical unit, and I'm taking care of adults that have chronic diseases, or they're recovering maybe after a heart attack or after surgery, just a wide range of things. And when I was taking care of them on that floor is when I realized that whole phrase that we don't have health care in this country, we have sick care. And that was being put in my face over and over and over again. And that was, a driving force where I'm taking all of my prereqs for ND school saying, I've got to get there fast because I have to change this system, right? This is a horrible system that we have going on. And unfortunately, the medical doctors are so overwhelmed in the hospitals that I would go in as a nurse and the patients would be like asking a million questions because the doctor could come in and talk for like 2 or 3 minutes and then leave and go on to their next 30 patients of the day. So when I would go in there, the patients would ask a million questions and want to sit there for a long time. So I would bring my charting system in there. I would chart, and while I'm typing what I see and what I know and their vital signs and their medications, I'm telling them about it. And I remember that feeling of like teaching the patients and them being so appreciative that I've had diabetes for 30 years and I never actually knew what it was. I've been taking steroids for, 6 months and I never understood why it made my blood sugar increase. So this whole process made me become like obsessed with, when I become a doctor, I want to be a doctor that can teach. I want to be a doctor that makes a lasting impact. And that's when, when I became naturopathic doctor, that whole docere thing, doctor's teacher, was like, that defines me. That's what I want. So I went from conventional to natural over this, 10-year period. And I've gotten to see both, but it definitely led me on this path. Very grateful for the education that I have, the history that I have with conventional medicine and what it's, that foundation. But I'm definitely glad that I ended up here on the natural side of things.
Yeah, definitely. I feel like I had a conventional background too. I got my degree in pharmaceutical sciences. I did not do like additional nursing training or anything like that, so it's definitely not as extensive. But I feel that on understanding the two different perspectives, and then also the docere part, like I never really even thought about it till naturopathic school, and then even so much more so until after naturopathic school, whenever I actually became a naturopathic doctor and I started doing these talks in the community and started these podcasts and stuff. And I realized how much I love teaching. I love talking about what is actually happening in our bodies. And like you said, people are so appreciative of that awareness, getting of their own bodies and understanding what's going on. And so yeah, I think that's beautiful. I think it's just so cool that we have the ability and that time. Like you said, medical doctors are usually really overwhelmed and overworked, and there's just no time. They can't even spend more than 15 minutes. Usually it's 7 to 10 minutes, right? And they can't spend more than that with the insurance system, the way our system is set up. It's set up against against that proper docere teaching, doctor as teacher kind of system. And so I think it's cool that we have that ability to do that, and I'm so glad we do. Okay, so what drew your interest in women's health and pediatric health specifically? I mean, you talked a little bit about how you were a lactation consultant and worked with kids or babies then, but what kind of drew you here?
Yeah, so what's interesting is that I'm drawn to like every part of medicine. My clinic is not just women's health and pediatric care. My practice actually consists of mainly autoimmunity, environmental toxicities, and very complex chronic diseases, but primarily women have those issues and coming to see me, and I am preparing them for pregnancy. But when I was in school, I did an abundance of additional education on autoimmune disease, infectious disease, environmental medicine, functional medicine, and a lot of functional neurology. I mean, I fell in love with functional neurology. You probably remember that. But I completed a postdoctoral program with Dr. Robert Melillo. He's a functional neurologist, chiropractor, and it was on childhood developmental disorders. So I was just enthralled with this concept of what they call functional disconnection syndrome, and that includes like ADHD, autism, and dyslexia, so on and so on.
Okay.
So, but during school, I also became a mom. So when that happened, my passion for pregnancy and natural birth and babies just like grew exponentially, you know, on top of what I had learned as a nurse. So I didn't want to make my entire practice about that, but I wanted and needed to, I wanted to educate as many people as possible on these topics. So how better to do that than to write a book and do blogs and podcasts and reach the masses, because I feel like I could affect these decisions more, I guess more abundantly by reaching people online than to do it one-on-one. But whenever I was doing all of this studying, all these different topics, I noticed this one trending topic that kept popping up in every single area that I studied while in school and those extra courses, and it was always preconception care. So that's that period of time that a woman, before she gets pregnant, where she's kind of preparing for her pregnancy. And so that importance of preparing for pregnancy kept coming up in everything that I've studied, and most importantly in the childhood developmental disorders. So that's kind of where I adapted this pediatric focus for not only preventative, but in kind of like treatment approaches for it. So I noticed it's very hard to treat these conditions, to help these patients. So why not focus so much on the preventative part of it? And that's why my first book was written about, you know, preconception care, because if you could possibly prevent something like autism by helping women prepare for pregnancy, I mean, goodness, like why not spread this information to, you know, help as many people as possible?
Exactly. And prevention really is the best form of medicine, right? And that's like the bread and butter of what we do. And it's interesting because I'm not sure when this episode will actually air at this time, but recently I heard Jimmy Fallon and Trevor Noah, they were talking about the situation right now with the coronavirus, and they talked about how we're doing the social distancing measures, like the quarantining, the hand washing, avoiding gatherings, all of that stuff. We're doing that to prevent a disaster, right? And one of the things that Trevor Noah said was, prevention is boring. It's not as exciting, right, to prevent something, but it's effective. And I was like, yes, exactly. And that's in all aspects of health. It isn't as exciting as treating the disease or like having something afterwards where you like pump it with big drugs or whatever it is, but it is so effective and so important. And I really want to stress that too, because I think, like I said, it can be boring. It's not as exciting and fun, but it is so effective.
Right, exactly.
Yeah. So, okay, so what was the term you called it for the triage of conditions, ADHD, autism, and dyslexia? What was the term for that?
Functional disconnection syndrome.
Functional disconnection syndrome. Okay, so how does preconception care play a role? I mean, this is a huge question. But how does it play a role in preventing the functional disconnection syndromes?
Well, so when I talk about it, I do kind of talk about the role of all childhood diseases. It's not just that, you know. So we once kind of thought that these conditions, like I know we're going to talk about this in detail in just, you know, the next question, but you know, we're talking about cancer, we're talking about obesity, diabetes, and neural tube defects, and functional disconnection syndrome, which is a whole umbrella term for all of these things. But we once thought that they were genetic, multiple genetic factors, environmental causes maybe, or unknown causes that were a threat to the child after they were born. But, and there's of course that vaccine debate specifically with autism. There's carcinogenic chemical debate with cancer. You know, there's been some connections, like possibilities, but everything was studied kind of after the child was born out of the womb, until a couple years back when they started studying like within the womb and seeing, are these developed before and after? So preconception playing a role in all of these childhood diseases is, I mean, now with all of these theories kind of combined, I'm suggesting that the child is possibly born with these conditions. It develops in utero, and then it's something that just kind of escalates after. So when we talk about a vaccine causing autism or something, it's more of like the child is born with a particular, let's say, set of symptoms with that may be classified as autistic. And then when they get a threat, a chemical threat or something that is introduced into their body, it is, it's worsened. The symptoms are heightened. So it's like, no, I don't find that it causes it, but it definitely makes it worse. So how can we go back and do this whole preconception approach to prevent it from even forming in the first place? Mm-hmm. So when we're talking about ADHD, dyslexia, autism, you want me to get into it specifically? Do you mind if we go over?
Yeah, go ahead. Okay. Yeah, we can kind of take it however you want.
Yeah, okay. So right now, autism is kind of the biggest one, right? Where it's the biggest threat. So there's a numerous amount of children that have epilepsy and ADHD and dyslexia, but autism is so like on the forefront because you have this rise of like 10 to 17% increase in cases every single year. And because of that drastic rise, we can confidently say, like, this is not a genetic disease. This is something else environmental or, mm-hmm. you know, like epigenetic. Mm-hmm. And so what we're seeing now, I think the latest data says 1 out of 34 boys, 1 out of 145 girls. So the average of 1 out of 54 children have autism under the age of 8. So it just keeps rising and rising. So people are like, okay, what can we do? Like, what is actually causing this? And essentially what the autistic child, if you look at it from a functional perspective, and you're looking at functional disconnected syndrome, what we're looking at is a child that has an extremely active left brain and an underactive right brain. So the left brain meaning reading, analytical mindset, certain types of math, and a lower functioning right brain skills that are emotional intelligence, eye contact, reading comprehension. And if you look at dyslexia, it's reversed. So it's a very, very high functioning right brain and lower functioning left brain. But what is causing the inability to connect from the right to left is the question. And so what Dr. Melillo was seeing was you can see these signs of a disconnection as the brain is forming in that first year of life. So they show delayed milestones, delayed primitive reflexes, which are those reflexes that basically keep a baby alive before their brain is formed to make real movements, and then retain primitive reflexes after the age of 1. So all of these things are signs that shows you, like the baby having a poor latch in the beginning and not having what they call the rooting reflex, where it's a reflex where they go towards the nipple to breastfeed. Yeah, so if that's not present, some people say, oh, they're a poor breastfeeder, but sometimes the primitive reflexes aren't present. They haven't developed because they didn't go through the right birthing process or something went wrong in uterus. All of these things that can take place to affect it, okay? So whenever I listened really closely to Dr. Melillo, and he kind of, he was showing that the research points to very specific things in utero. And you can find this in all of his books, which I'll kind of give you a list of those later. But
Okay.
It's either the man or the woman. It's not just the woman, which is always, we're finally coming around to that, I feel like, but the research is not so much about. It's not just actually the man's age either. The increased risk factors that they were finding in the research for autism was a man, the father, being over the age of 40. A man heavily exposed to heavy metals like mercury and cadmium, vitamin D deficiency in either the man or the woman, sedentary lifestyle between either the man or the woman, high stress in pregnancy, poor nutrition before or during pregnancy, a poor gut microbiome, both male or female, believe it or not, and recent home renovations, moving when you're pregnant, something that's more stressful, airplane travel a few months before you get pregnant. There's like all of these things are finally making this connection to where those things were also linked to a higher incident in autistic children. So all of these threats have been identified, and they can all be addressed with preconception, aside from the age factor and the genetics. So because if you have one risk factors associated, maybe it's a man or woman that are over or getting close to that age of 40, they can do all of the other stuff to implement, make sure they don't have any other risk factors to kind of reduce that risk, because obviously you can't change your age. And I don't want people to think they can't get pregnant just because they're older 30s, because I do not, but I don't believe that theory. So we can't change our genetics, we can't change our age, but we can change the way that our genes are expressed and how they're turned on and off, which is that whole study of epigenetics. So conditions that I'm mentioning all play that role in an epigenetic fashion that we can change. And that's where this whole plan of preconception care comes in, to modify all of those things. But some of the other ones I was mentioning about neural tube defects and childhood cancer, I mean, there's this huge prevalence in childhood cancer. For me, of course, I had a husband with childhood cancer, so to me, this is real. It hits home base, and we did everything that we could to quite possibly prevent it. Now, some things just happen, some things you can't prevent. But are you here?
I'll let you know.
In 2018, they had an estimation around 15,000. It was more than that, but around 15,000 children were diagnosed with cancer. So it's more than it should be, because everyone says, well, if they're just born, like, where is their threat? I don't understand it. They haven't been around long. It makes sense for an adult. They smoked their whole life, or they ate a poor diet, and then it catches up with them when they're 40 or 50. But why are we seeing 2-year-olds with, neuroblastomas and all of that, or leukemia? So one study that I found really interesting, it's very wide, a well-known study at this point, is in 2014, the Environmental Working Group, along with Commonweal, did their study that showed a total of 287 chemicals and pollutants inside of the umbilical cord blood. So when they were born, they took the sample, and it wasn't a huge sample, so they should be doing this on a larger scale to see, and maybe see what areas are higher and what chemicals. But that money doesn't always go to those sorts of studies. But within those 287 chemicals that they found, 180 of them were linked to cancer. 217 were linked to toxicity to the nervous system, and 208 of them were just caused to birth defects or abnormal development. So some of these things you don't see right away, but you see the effects whenever they're developed.
All right, you can go ahead with what you were saying with how these chemicals, we don't necessarily see the effects until afterwards, right. but they're there. These toxins are there.
And that's why it's really hard to track it. It's really hard to say, like, this caused this to my child, because it's not immediate. But they do have studies separately that show these chemicals are linked to cancer, and those chemicals were found in the cord blood. So could it be possible that that's the reason why maybe some of these children had a higher level of that exposure, and cancer began when they were in utero or shortly afterwards, and then it grew until it was actually noticed when they were a couple years older. So there's always that possibility. But the point is, we used to think the placenta would protect the baby, and it does to an extent, but there are many, many chemicals now, as you've seen, over 287, that can actually pass through, and that will be recirculated because they don't have a functioning liver, but they do have kidneys that are filtering it out. It goes through the urine and it's just recirculated, and it's not leaving their amniotic fluid. So they're just constantly exposed to it. So this isn't to like freak people out.
Right.
Instead, it's to say, just identify these chemicals and avoid it as much as possible. And then obviously the preconception care, if you've been exposed to those chemicals, it's nice to identify them, to know, oh, my job pre-exposed to me, or I was living next to a plant or next to a golf course that had lots of pesticides, maybe I can cleanse it out in an effective way for those chemicals before I get pregnant. Because what people don't really understand is the most effective cleansing or detoxing you can ever do is to get pregnant and then to breastfeed. So it's unfortunate.
Yes. Yeah. So that is really important to do that cleanse before you even consider getting pregnant, and wait on that for sure, so that you can get rid of all those toxins so that your baby is not overloaded with those toxins.
Absolutely. Absolutely. So the other thing, you know, a lot of people talk about neural tube defects, you know, like spina bifida is probably the most well-known, and the thing that maybe has a warning sign on the back of some medications that people take and so on. But the truth is that we don't see spina bifida a lot. We see a lot of like minor neural tube defects that can affect a child kind of later on in life, or maybe that early stage of breastfeeding, cleft lip, cleft palate, tongue, and lip ties, where that frenulum is super tight on the tongue and then the lips, and maybe even on the cheeks. And these are all midline defects. A bifid, uvula, sacral dimples, and even if the child doesn't have a problem with breastfeeding, but later in life they may have tight neck, tight back, and cause structural deformity. So not as severe, but still kind of a lifelong thing. Let's try to prevent it, or you can absolutely seek care to treat it, you know. But signs of that would be poor breastfeeding, poor latch. They may have colic, gassiness, reflux in those first, 6 months of life if it's not, not treated. But in those cases, it's possibly associated with the chemical, but also associated with deficiencies and things. So we're talking about an excess of toxins possibly causing certain issues, stressful events and different things in life, and different health effects that you have possibly causing something, and then also these deficiencies possibly causing something. So neural tube defects have always been associated with low folate, but it's also B12, it's also choline, it's quite a few things. So MTHFR SNPs are becoming widely known. Almost every single one of my patients come in and say, I have MTHFR heterozygous, like, what does it mean? And sometimes it means a lot, and sometimes, like, who cares? Because if you keep eating correctly and you're taking your folate, but in this case, if you have an MTHFR SNP and you have symptoms of like low energy, poor, periods, it's a whole array. I have the whole list in my book, but you know that you require more supplementation of folate, and a correct form of folate, which would be a methylfolate, and not a folic acid. You would require that more if the other person who doesn't have that SNP. So there are some genetic components, but always able to kind of be adjusted or modified with your lifestyle and the epigenetic component of it.
Yes, definitely. Yeah. And I think that is something that is, like you said, commonly known. People talk about the MTHFR gene mutation more regularly now. It's just becoming more mainstream. And it is really important to get those methylated B vitamins, because I have seen in my practice patients who are not on the methylated B vitamins, and they're trying to get pregnant, and they're not feeling good just taking the prenatal, right? And clearly they're reacting because they don't have or they have that MTHFR gene mutation. So I think that's really important to address too. And then whenever you talk about the deficiencies and all the environmental toxins, I think, again, like, bringing into that picture that it's always multifactorial. Like, it's rarely ever just one thing that leads to disease, right? Of any sort. And there's rarely one thing that can reverse disease. Like, it's always multifactorial. There's so many parts play into it. And so it's important to be mindful of that. And then also working with someone like yourself or myself, I think it's really helpful because then we can streamline that and individualize the care versus reading things online or whatever it is. It's just like there's just so much information and there is so much you can do, but not to get overwhelmed with what's right for you.
Yeah.
All right, so we're kind of running out of time now, but I really appreciate all of this knowledge and that you're giving us right now. It's really helpful, especially understanding what potential things to look out for. Again, I want to emphasize that this is in no way to shame anyone or have any pressure, like additional pressure added to parents, because as we all know, there's enough pressure for parents as it is today. But it's just to really educate and empower and inspire people to make some of these changes so that the future children don't. I mean, we can minimize the risk, right? Again, like we said, things can always go wrong. There's always stuff happening. It's multifactorial. We just got to do the best that we can. Okay, so before we move on to the rapid fire questions, was there anything else specific that you'd like to add or any resources that you recommend for our listeners?
Well, if you don't mind, quickly I'll go over what I would consider like a proper preconception care. I won't go into details, but just like an overview of it. So I guess let me see, how can I do this really quickly? So besides looking at the okay, so if we're looking at a man and woman, the preconception care basically will be the same for all of them. Okay, there's not a specific one for cancer or for autism or what have you. It's all based on your level of toxicity, how long have you been exposed. Maybe you could do it based on labs, but just basically that history, your lifestyle choices, and possibly looking a little bit about your genetics, like you said, MTHFR. But that's just one of many. Overall, the idea is just to remove the potential threat. So that's the avoidance phase. Cleansing the body, healing the gut, really, really important, and focusing on those foundations of health several months before conceiving. So this is what I wanted to hone in on. It's very important. It takes about 4 months of preparation to achieve a healthy sperm and egg. A woman is born with all of her eggs, but it takes about 3 to 4 months to mature, and a man is producing sperm continuously. So every 3 to 4 months he's producing it. So you have to give yourself that amount of time if you're going to make significant change to the sperm and to the egg to create the healthiest possible union. Which means you do not want to be cleansing or doing anything and have any of those exposures during that 3 to 4 months. So all you're doing is avoiding and replenishing and doing your preconception vitamins that you could do. So this is always man and woman. It's never just one. We want a healthy sperm and an egg. You can do this for just the 4 months like I talked about it, but you can do 6 months, a year, 2 years even, depending on your level of toxicity or your determination or however long you have, that you can work with. I always work with people where they are and trying to make the healthiest pregnancy for where they are. So during those 3 to 4 months before conceiving, you have that healthy diet, clean water, good sleep, but the supplements would be like a prenatal vitamin, extra folate if needed. Most of the time that methylfolate, not a folic acid, especially if you don't know if you have this MTHFR mutation. Vitamin D, DHA or fish oil, vitamin C, probiotics, choline, additional choline. And a man, in addition to all of those things, and yes, he can take a prenatal vitamin as well, or he can take a men's multivitamin, but glutathione and zinc have been shown to be very, very effective in improving sperm motility and morphology. So that's a quick overview of basically
definitely. And I think it's important to note that dosing and everything can be different per person depending on what, like we said, deficiencies or what toxicities you have, and very individualized. But it's very general.
Yes, exactly. And always great too, if, I've written my book, Preparing for Pregnancy. So it's a complete guide of preconception care. But it gives you those options, meet you where you are, 4 months, 6 months, 1 year, 2 year. However, it's always good to take that, read about it, learn about the information, educate yourself, and then even bring it to a naturopathic doctor or a functional medicine doctor to say how can I create this for me? let's draw my vitamin D level. Let's do a micronutrient panel. Let's see what I really need instead of just a general approach, which we have to do in like a book format.
Exactly.
Yeah.
Okay. All right. Well, thank you so much for all of that. And let's get into the rapid fire questions. So you don't necessarily have to answer these questions rapidly. They're just kind of more general questions that I ask all of the guests. So the first question is, we talked about how Mahan Health means great health. So what does Mahan Health mean to you?
Yeah. So great health. Okay, a lot of people, they'll come to me or they'll, I don't know, they're in denial about what exactly they need for their health, or they don't want to approach it. And they say, well, I did that for years and I turned out just fine. And our goal, like, to me is I don't want to just not die, right? I don't want to be just fine. I want me, and for my patients, I want to establish that great health. So to me, this is like ultimate health, meaning your mind, your body, your spirit is all vibrant, not just kind of making it by. So like your life force is beaming. You wake up in the morning, you feel energized, you feel bliss. And I know that not everyone has that, but it's always something that I ask that people strive for, because it's something that I strive for with myself. I'm not waking up every single morning completely energized. That I do, I wake up and I'm like, that is great health. Like I just woke up with the first thought being positive. The first thought being how grateful I am. That first movement of saying, oh, this is so amazing. Just that feeling. Like whenever I had to look up what Mahan meant. I had no idea. But I think it's amazing. I think that that's a perfect title, or a company name or whatever, practice name. So
thank you. Yeah, I like that. I like that it's vibrant. I like that word a lot. And that's essentially what we're all striving for, or I hope that we're all striving for, right? And I like that, waking up with that bliss and gratitude in the morning. Okay, so my next two questions, they could be related. They don't have to be. It's kind of up to you and what your situation is. So, but I'm going to ask them together. What was the most difficult health change for you to make, and what is something that you're still currently working
on? Meditation. It's not so much the meditation part, but taking aside the time of the day. So my answer is the same for both of them.
Okay.
Like I'm constantly getting into, the habit, the routine, and then I fall off, especially like with what's going on right now in the world, and I need it the most right now. Then I'm also as hectic as I could ever be, so I don't have the time for it. So that's definitely something I have lacked, that I've always wanted more of, that I always come back to, but it's hard for me to keep that routine. Diet and exercise and all those things have been pretty easy for me. I've tried every single diet that's out there, achieved it, but everyone has their strengths and their weaknesses, and this is definitely one of those things for me.
Mm-hmm. Yeah. Meditation is a hard one too, because I think that's something that I've struggled with as well. Recently, I've done a lot better with it because I notice how I feel so much better every day whenever I do it. So I've been every time, and so I've been better with it. But yeah, it's a hard one for sure. And I think I do talk to a lot of my patients, a lot of people, a lot of my listeners. I talk about meditation all the time. And so I'm sure so many people can relate to you on that. So I appreciate you sharing.
Sure. Mm-hmm.
Okay. And then my last question is, if you could have a commercial about anything health related, like a PSA that would be blasted to the entire world, what would it be about and why?
Meditate more.
Yes, I love it.
I think more so, I get it the most in my practice, and all jokes aside, back to this idea of, hey, that didn't kill me, or I'm doing just fine. Like, I think that I would love to create a commercial, and I'm actually about to create a commercial for my business, and this is the idea. It's like, I want people to see that vibrant health is possible for them and for anyone. It doesn't matter how long you've been sick. It doesn't matter. Like, you can conquer that. You can achieve that in your mind, in your body, and in your spirit. And it has nothing to do with curing some kind of diagnosis, but like, and the thought, I believe you can do it. So a commercial that has meditation, but also just shows that that vibrancy,
Right.
what we can all achieve.
Yeah. And I like that because I do think that some people, if they've suffered through something for so long, they feel like, well, it's just the way I have to live now. And then people use the excuses, we're getting older, like, so I'm getting older, I'm supposed to be suffering and in pain.
Yeah.
And I hear people in their 30s saying that, and I'm like, listen,
Yeah.
you're no, just
Yeah.
no. Um, so yeah, so I appreciate that, and being like, it doesn't matter what stage of life or disease you're in, you can experience that vibrant health. All right.
Absolutely.
All right. So, okay, that's all the questions I have for you. My last question is, where can people find you, and tell us a little bit more about your book and where people can get that too.
Okay, so I have two different platforms basically that I work with. So Dr. Sarah Duhon, so it's S-A-R-A-H, Duhon, but it's D-U-H-O-N. And I have drsarahduhon.com, and on Instagram, dr.sarahduhon, Facebook, Dr. Sarah Duhon, That's going to be where you're going to find all my preconception, all the maternity, prenatal, and newborn, that first year of life. That's where I have my blog. That's where I have my book. That's where that information is going to be found. And then my local business is called Illuminate Natural Health, and that's at illuminatenaturalhealth.com. I also have a blog there with just basic, health information. And then that's where patients would go to schedule with me for autoimmunity or preconception care.
I hope you enjoyed that episode and now have a better understanding of why it is so important to have a preconception plan. Personally, I am not ready for children, but I am still working on optimizing my hormones, and I've been working on optimizing them for years, and they're still not optimal. I do this though, so I work on my health and optimizing my health and hormones so that when I am ready to conceive, I don't have any complications. And this is why this is so important. And like she said, pregnancy is the best way to detox. So even if you are able to get pregnant easily, it is still really important to plan in advance if you can to optimize your future baby's health as well. All right, I will have Dr. Duhon's information and the resources we mentioned in the show notes below, so make sure to check that out. And make sure you check out her book so you can start your journey to an optimal pregnancy and postpartum period. All right, that's all I got for you all today. Wishing you all Mahan health, and I will see you next time.